All right. Hi, everybody, and welcome. We're going to go ahead and get started and kick things off. I know we'll have a few others joining as well, but I just want to first start by thanking all of you for joining us today. We are so excited to have this session and to have a wonderful group of family representatives joining us to share their experiences specifically through this pandemic. And as many of you may already be familiar, this is the third session and our final session that's a part of a larger series we've been hosting over the last few months, really focusing in on reflections from different perspectives of stakeholders and individuals who are a part of the newborn screening community. And so we are so eager to share the perspectives of families in this session. And look forward to having an opportunity really to engage with each of you as well on your experiences. Now that we've been a year out of COVID, it's a really great time to reflect on the lessons that have been learned and the things we've started to gain understanding of, and really think towards a strategy for supporting families in the future through additional health emergencies. And so we really want this time to be a time of engagement where we can learn from one another, and we look forward to having some time for discussion later in this session. So I do want to address and thank our partners at the Health Resources and Service Administration who partner with us to conduct the work of the Newborn Screening Family Education Program. And it's through this funding with HRSA that this work has been able, or that we've been able to accomplish this work. And so thank you to our partners at HRSA. While I'm quickly going through the agenda and plan for today, we're also going to be launching a poll. So we'd like to get a bit of an understanding and gain some perspective on who is joining us today. We recognize that we have quite a range of individuals who have registered for this webinar, including other family representatives, representatives from parent-led and advocacy organizations, a number of state screening programs and health professionals. So we'd really like to get an understanding of who we have joining us today and what your potential goals are and the things that you hope to gain from this session. And in just a moment, Brianne is going to be sharing the results of this quick poll, but thank you for participating. And just to let you know, there are a number of questions or a few questions to answer. So please be sure to scroll down and answer all of those poll questions. The agenda for today and the format for today is, again, one of engagement. And we really want to encourage your engagement through the chat box, as well as through our community discussion, which we will have in just a little bit. So to kick things off, I'm just going to provide a very quick overview and recap of some of the key takeaways that we've identified from the first two sessions that we've hosted in this series. And then I will moderate and facilitate some pre-recorded interviews with our wonderful panel of families. And again, we will also be utilizing some polls to engage with you and just seek to understand what some of your experiences have been as you have gone through the last greater than a year with dealing with the COVID pandemic. So we really, again, want to just utilize those polls as a way to engage and generate some discussion. And then following, the moderated session with our pre-recorded interviews with our panelists, we will also have an opportunity for question and answer with our panelists. Each of them has joined us today. And we will also, have an opportunity to just engage as a newborn screening community on strategies for supporting families through COVID and through additional emergencies in the future. As always, if you have any questions or need technical assistance, we do have individuals from the Expecting Health team that are manning the chat box. So please do not hesitate to reach out through the chat box with any questions to our team. And this session will be recorded, and we will be sharing and posting this on YouTube following this webinar. So Brianne, did you want to go ahead and share? Great. So just to recap who we have joining us today, it does look like we have quite a few number of individuals representing the newborn screening programs. And we also have several family representatives and advocacy representatives as well. So thank you all for joining us. And definitely, it seems as though many of you are here to listen and learn, and that's really, I think, great to see. We hope that each of you can take away some tidbits and, again, help us engage and strategize together as a community on ways that we can continue to support families going forward through additional emergencies. So, just to briefly review what the learning objectives are really for this entire series. And again, this particular webinar, I think we'll delve deeper into sharing family perspectives, but as a whole, what we're really hoping you'll understand after this entire series is that the newborn screening community is complex, and there are a number of stakeholders that are involved and perspectives that are involved. And so just helping to bring clarity of who are the different stakeholders and representatives, and what are the degrees of complexity within this newborn screening system that we can sort of seek to minimize kind of working individually and work together more as a community and as a group. We really want to seek to understand how families were supported through the pandemic. And I think you're definitely going to hear a lot of those perspectives through these interviews. And then again, really the big picture and the most important objectives is to take these lessons that we've all learned from our different experiences and perspectives and really think about what are the strategies that we can create to support families through these future health emergencies. Just to recap, we have hosted 2 prior sessions, and we will be sharing links to those sessions in the chat box now. If you're interested in listening to those and you were not able to join previously, we do encourage you to do so. In our first session, we really highlighted the perspectives of healthcare providers and had a panel of different types of healthcare providers that supported families through newborn screening experiences over the last year. And in our second session, we had a really engaging discussion with state laboratory representatives, including both the lab perspective side as well as the follow-up perspective. And so I think in both of those sessions, we really gained a lot of great perspective on what each of those stakeholder groups had to think about as COVID was starting, as they were working through supporting families, and now that we're a year out. Some of the key takeaways that we gained from those 2 prior sessions are summarized here. And really, I think one of the big things and one of the key takeaways that we're hearing consistently from this series is that while COVID and the pandemic certainly caused some interruptions to the operations of newborn screening continued. And babies were still diagnosed through newborn screening, and diagnosis and care was continued. And I think that's a really important aspect to keep in mind. We also are hearing and have heard from stakeholders that COVID-19, as big as it has been, is not the only emergency that families, state programs, and other groups have had to manage over the last year. And so we had a really interesting discussion with our state laboratory partners about complex situations where there were multiple emergencies going on simultaneously. And again, really thinking about how do we continue to support families through that and ensure that operations continue smoothly and that newborn screening continues. I think a key to that is, and we've now heard this from each of the different perspectives in slightly different ways, that adaptability and flexibility are really the key to continuing smooth newborn screening experiences. And part of that is thinking about how do we leverage a system of different stakeholders to encourage that flexibility, adaptability, creativity, and continued communication across these different groups. So I think, we're continuing to learn, we're continuing to build on these takeaways, and I think we'll continue to hear some of these additional perspectives today from our families. So we've been following a framework for each of these webinars of really thinking about what were some of the activities and initiatives that were started at the beginning of COVID from each of the stakeholders' perspectives. And so today, as we listen into our families and learn from their experiences, you'll also hear this same framework used in the interviews that we conducted, specifically asking our family panelists to share with us, what did you start doing when COVID first started to be something we were all aware of and something that we were all dealing with? What were the things that you had to prepare for, and what came to your mind? what were some of the things that you had to stop doing or adjust immediately as a result of COVID? And how did you work through or overcome some of those potential challenges? And then now that we are in a place where we can reflect back on these experiences, what are the lessons learned and the advice that we can give to really think about sustainable structures and models for family support in the future? So that gives you some context of the framework that you'll be recognizing in these interviews. So to get things started, I'm really excited to introduce our first panelist, Miss Isis Willis. And Miss Willis is the mom of two beautiful babies that you can see here. And her youngest child was diagnosed with sickle cell disease during the pandemic. So without further ado, I will share with you Miss Willis, experience.
Okay, hi, my name is Isis Willis. I'm 23. I have two children, a boy and a girl. My daughter is 1 and my son is 3, soon to be 4. We're from New Jersey, but we live in Pennsylvania, Greensburg. And I heard about the newborn screening. I've been heard about it when my son was born, but I got more deep in depth of what it is once I had my daughter.
Tell us a little bit about your daughter.
My daughter is 1 year old. She has sickle cell disease, and she attends Pittsburgh Children's Hospital for her daily appointments that she has.
Okay, so she was diagnosed with sickle cell disease through newborn screening at the time of COVID. Is that right?
Yes.
COVID. Okay. So let me start asking you a few questions, if you can kind of take yourself back to that time, right as you were getting ready to deliver and right as COVID was starting. Tell us what was going on in your life and what were some of the things that you were thinking about at that point. You were pregnant, right, and about to deliver.
Yes, at that point, I was pregnant with my daughter when COVID was happening. Well, in the beginning of COVID, it wasn't as bad at first because I didn't have anything to really worry about. I was still able to bring my sons to the appointment. So I wasn't really, concerned about stuff like that. But once it started picking up, as in the numbers of COVID going up, it started to get a little bit hard, being as though the fact that I'm in Pennsylvania by myself and I don't have any family. So it got hard on me because I couldn't bring my son into the doctors. That would be the major part that was hard on me, was my other child, because I don't have any family out here.
Absolutely. Walk us through a little bit about kind of what you had to think about. Right as the world was learning about COVID, you were getting ready to deliver. I mean, that was all happening at the same time. So
it was really scary because it's like, I've known so many people to go in the hospital to get treated for one thing, and then all of a sudden they got COVID, and it was a bunch of stuff just not adding up, not making sense. But now when I was going in there, my head was all over the place. I didn't like the fact of I had to wear a mask while delivering. Nobody wants to wear a mask while pushing a baby out. And it was just a lot. And then the whole stay, I had to keep a mask on when the doctors entered the room. And they was in the room often because, they have to check the baby and stuff like that. So wearing a mask was my biggest pet peeve, especially when being in that moment.
Yeah.
So that was the biggest thing that was, lying on my heart was, is my baby going to have a disease? It's like, what's going to happen? Because I was scared to get the, I don't know the exact terminology for it, but the needle that goes through the belly button. I was scared to say that again.
During your pregnancy test for sickle cell?
Yes, they asked me to take that to see if she will have it so they can prepare me mentally of what was going to happen. But I was more so scared of doing that because I know it could risk for a miscarriage. So that was more so that was roaming through my mind my entire pregnancy. I done went through depression, not knowing if she was going to have it or not. And once it resulted in the fact that she does have sickle cell disease, that really, it just broke me down.
So don't mind sharing a little bit about that part of your journey. How did you first learn about the diagnosis?
Well, I'm the type of mom, I Google everything. So I started Googling what sickle cell disease was. But once I was able to get into the doctors, which is at Pittsburgh Children's Hospital, and I was able to meet with her hematologist, she broke everything down to me of what sickle cell was. It still wasn't hard to, hear, yeah, your daughter has a disability, your daughter has a disease, and you have to watch certain things with her. Like she's a normal kid, but she's not a normal kid. So it's like, it was hard to just bear and think about and take in all at once, especially with COVID going around. You got people in my ear about that. So it was just a lot, to take in at that point in time. But one thing I can say is that her hematologist doctor was very, very understanding, and she was very compassionate, and it just was there. Like, she just cared so much about my feelings and about how I was caring about how I felt, and she was a big support in opening up, and also opening up new information to me was a big eye opener.
Sure, absolutely. So kind of thinking about the last sort of, year. So again, you delivered right when COVID was happening. You're juggling that, you're figuring out what sickle cell disease is. You're, as you've said, alone in this city. Kind of what were some of the challenges that you had to deal with after you got this diagnosis?
The challenges I had to deal with, I believe it was a couple of months after she was born. She had to be hospitalized because she caught a fever. I think that was the most challenging moment, and it still is a challenging moment in my life, being though I don't have anybody out here. COVID is still going on, so doctors are, being cautious with children and not allowing them to come to the appointments and stuff like that. So it's more so of when she's hospitalized, that's the most challenging moment ever. Like, it's just challenging for me.
Yeah, I can only imagine. And so I know there were a lot of things when COVID was happening and is happening that, families had to really think about and stop doing because of the particular diagnosis that they were managing. So anything that you feel like you had to stop doing once you found out a son was diagnosed with sickle cell disease?
I'm from New Jersey, like I said, so I was going back and forth to New Jersey a lot before I had her. So me having to slow down on going to New Jersey after I had her because of COVID and stuff like that, that was a lot on me because that was my only outlet. I don't have nobody out here. I don't have any friends. I don't have nobody I can talk to or, just go out with. So that was my only outlet. But I did have to, slow down with that as she's gotten older. But now we're back out there visiting family and stuff like that.
Yeah, well, it's hard. It was a huge part and continues to be a big part of what I think a lot of families are having to figure out. How can you connect and who can you connect?
Yes.
That's super, super helpful. As far as I know, you had mentioned to me, you also had to figure out childcare. It was a big challenge for you, just, really thinking about that. Share a little bit about that. What did you have to think about?
Well, I just recently had to put my kids in childcare because I did start going back to work, thank God. So dealing with that and me having to put them in childcare more so, I really wasn't worried about my son because he's older and he doesn't have a disability, but more so of my daughter because, as of course, sickle cell disease is major. And I asked a lot of questions. So I was asking the doctor, like, has any kids ever came across COVID with sickle cell disease? And like, what was the outcome? So it's just me having to put them in school that really was like, oh my God, like, I don't know what to do. Should I do it? Should I not do it? But now what I do and what I tell everybody else to do, nobody can dictate what your daughter has but the man above, which is God. So I just pray and ask God to watch over my kids while I'm not there and, pray that their immune systems could battle whatever they're trying to fight off.
Into Asani's medical care. And again, this is sort of happening all at the time that COVID was ramping up. How did she receive care? How did she see her doctors? Did she use telehealth? Did you go in person?
We actually did both, being as though the fact of I lived at that time in New Florence, Pennsylvania, which was an hour and 30 minutes away from her doctor. give me 1 second. So we did, we went inside, you know, one month, and then the other month we'll do telehealth, and then the following month we'll do in-person visit. So one thing I can't say about her doctors, they did utilize both.
Okay, great. And was there any guide for you to kind of help figure out where to go and when to go there? Or how did you figure out if you were going in person or needed to go through telehealth?
Normally with what Ms. Margaret does, she, like if we go in person one visit, she'll schedule us to go in for a telehealth visit, but she'll write it on the paper. This is the date, the time that you need to be logging on. They do give you a little pamphlet that explains and how to walk you through the process of logging on and, you know, getting on the Zoom call and how to get connected. They also do give you a phone number if you're having like problems accessing the link at the time.
Gotcha. Okay, that's great to hear. Were they thinking through connecting to other families? I know you've mentioned that a couple of times. Is that something that you've been able to do? Or are you connected to any other families with sickle cell disease?
Well, as of right now, I am a part of the Sickle Cell Foundation. So every month, one day out of the month, they do like a Zoom meeting. But I haven't physically been able to meet anybody, you know, face to face because of COVID is going on. Normally, the Sickle Cell Foundation, they'll have like little events for the kids. They'll have them, you know, go to the zoo, or they'll have them go to like basketball games or stuff like that. And that nature, they'll have, you know, for the families to do. But since COVID is going on, I talked to Ms. Tawana. She said that nothing is happening right now because of COVID. Okay. So I haven't been able to come across anybody.
But when that opportunity comes up, that might be something that you'd be interested in to try to. Yeah,
of course.
And I know we talked a little bit about the resources that you've found. But what would you say have been the lessons learned after this year?
You said what would be the lessons learned after this year?
The biggest lessons learned of navigating through a pregnancy, a delivery, and a diagnosis all during COVID?
The biggest lesson learned, for me, I feel as though, I know I would have never changed anything, but I feel as though, you know, if I would have took the needle in the stomach, it would have eased my mind a little bit more mentally, and I would have not been so hard on myself with that. Because sometimes I blame myself, and you know, like it's my fault, you know, why she's going through this or why she has to suffer and stuff like that. And then more so too, my son having to getting adjusted, you know, with a new sibling in the house.
Yeah, so I know you've talked a lot about the support you've gotten through your family and through the Sickle Cell Foundation, and also through nephrologists. So I think you bring up a lot of really important places where people go for help. And that's, you know, I think those are the places that we need to be thinking about as well. So I appreciate that.
Okay. Hi, my name is Isis Willis.
All right. Thank you so much, Ms. Willis, for sharing your experiences. And I think there's definitely a lot you know, to take away from that discussion. So as we transition to our next panelist, I think one of many takeaways from what you shared is that childcare is certainly always complex to coordinate, but even more complicated and difficult during the pandemic. So we'd love to use this time to engage our those of you who are listening in to kind of assess a little bit more about your experiences with childcare as well. So while I introduce our next panelist, please take a moment to respond to the poll that you see on your screen, sort of asking a bit more about your childcare experiences during COVID. So next we'd like to introduce Ms. Jody Turbo-Roberts, who is also the mom of 2 children and also experienced a pregnancy and a delivery during COVID. So in this next interview, you'll hear a little bit more about her experiences delivering her baby, as well as a bit more about her older child who was diagnosed with hearing loss after his birth.
Sure. So my name is Jody, and I live in northern Minnesota, up near Canada, a very remote rural area. we had a child who is now 2, born 3 months early. So we spent 3 months in the NICU, 2.5 hours away from our home. And then most recently, we had another baby during the pandemic who was born at term. So that was wonderful. The biggest challenges that we have are just being so remote and far from healthcare services and early childhood.
And tell us a little bit about your first child's sort of birth. How did you sort of learn about or get, kind of connected to the newborn screening community?
Yes. So because he was born 3 months early, we were connected with a massive amount of resources. And one of those resources was Family Voices. And the person who I communicated with mostly is just a fantastic advocate. And we actually met at a Minnesota Department of Health working session for families of children and youth with special health needs that I had joined mostly because I had a preemie baby who was born very tiny. And so I wanted to learn more about how to get services in our rural area because I knew they were lacking. And so I just started joining as many committees as I could to help advocate not only for my son, but for our community at large. And Family Voices just was really supportive, and they actually connected me directly with Expecting Health and the newborn screening process. Even though my son had already gone through the newborn screening, Minnesota has a quite robust system. He does have hearing loss. It was sort of anticipated. And so we went through the regular screening at the hospital, came back all fine. But then then they went to do the hearing screening and he failed. And we told them in the NICU, like, yeah, we kind of expected this. And so don't do it again, just give us a referral to audiology. And we already had a team set up. So that's how I connected, was directly with Expecting Health, was through the Family Voices.
Gotcha. So we're definitely focusing a lot of our discussion today on your experiences sort of during COVID. So if we could go back a little over a year ago to when COVID was first starting and we were all kind of getting used to what that could mean. You were pregnant at that time, correct? Mm-hmm. Yeah. So if you could share just a little bit about kind of what was going on in your world at that point, and what some of the things you were thinking about were as COVID was first getting, as we were first becoming more aware of COVID.
Yeah, so we as a family were watching the news worldwide for quite some time before it was actually marked as a pandemic. So at that time, we were still recommended by the NICU physicians to not have our son in daycare due to his low immune system because of his diagnoses and prematurity. And so we were kind of living in isolation already, and we were expecting that we were going to be able to go into larger crowds over the summer. We had just had that conversation with the neonatologist at the hospital, and then COVID kind of spun out of control, and we were like, well, we've done it for a year, we're just going to continue. So for us, not too much had changed, actually. And because we live so remotely, the services that he needed, audiology, we have to drive 2.5 hours for, and there was a policy in place for how we can still see our audiologists, and they were making bigger exceptions for young children than they were for the elderly who needed hearing aid tweaks. So they were allowing us to go into the facility, and then they were having a little bit more restriction on people who didn't necessarily need to go in. They were meeting people out in the parking lots. And so that was not a problem for us, really, because they were prioritizing children, which was fantastic for us. And then regarding like speech therapy and services, early childhood services, our area just really has nothing. And so COVID actually opened up the world a little bit more, because now we have access to telehealth services. I am by no means saying that they are equal or, the same, but they're services, and we had nothing. So in a way, COVID really helped our rural area, because it allowed that, like, I feel like we jumped ahead a decade in the ability to have and use telehealth versus before the pandemic, it was lots more limited.
Can you share, and you have shared a little bit about this already, but anything else you would add as far as anything you plan for in terms of care for your child, and especially not just because of COVID, but also knowing that you live some significant distance away from the regular healthcare providers that you were seeing?
We just stick with our specialists that are 2.5 to 6.5 hours away. The ones that are the farthest away, we're able to have procedures, test sort of stuff done at 2.5 hours away, and then do telehealth with them. But as far as like childcare, our son wasn't eligible, like it was recommended, he didn't have any. So we had already just been providing our own care, and we still do. So it's one of the blessings really to living where there's like nobody is that you don't see very many people. So it's easier to isolate when you don't have anyone to be around anyways, So that's a blessing, I guess, for us.
So in these last couple of minutes, we'll just kind of transition to, now that you are a little over a year through in COVID, what would you say as you look back and reflect on that year are your biggest lessons learned as a second-time mom, as a person who delivered, just kind of all of these experiences? What would you say are your biggest lessons learned as we think towards supporting?
Yeah, I think the biggest lesson I learned was I'm in a lean-in group now that I just joined in January, and lean-in is supportive network for folks. And our mantra is, we can do hard things. And what I learned was that I can be a full-time public servant, basically, and have my kids at home. And I find it very joyful to be, I feel like when we're all working from home with our children and our dogs and our cats, like we're all on the same playing field. Like it just levels the ground in the workforce. And what I'm hoping is that this will become okay, even without pandemic times. And, I've heard a lot of people, parents, moms, dads have to leave the workforce. And I feel so bad about that, because I know there are some jobs that you can't work from home, but I know there's a lot of jobs that you can. And to just embrace the fact that somebody's dog barks in the background, or somebody's child is, running behind, in the camera, or wants to join the Zoom meeting. And I personally love that personal connection that working from home has brought, that I don't know that I would have known about certain things about my coworkers, and my coworkers are statewide. If we hadn't been able to be invited basically into people's homes as we work and we meet and communicate. And for me, I just feel that is a super beautiful thing. And if we want women to be able to stay in the workforce, I think that's really important for financial stability, for children to be, growing up, with more stable incomes in their parents' lives. It helps them as, they develop. And I hope that we can, as a country, just learn to embrace home offices. it's not for everyone, but if it is for someone, I feel like we need to embrace that. I think the biggest advice was just believe in yourself. And if you don't know, ask, and if you don't know what to ask for, say that. Just be honest and say, I don't know what I should know, so tell me everything. And then know that you can do those hard things. Know that you're your best advocate for your child. Your healthcare provider is not your best advocate. You are as the parent. And so ask them what resources are available, how you can get support. If you are navigating a million appointments, there's always people that are employed that do that. They can help you set up multiple appointments at multiple facilities. And yeah, just ask and tell them, I don't know what I should be asking for, but I know I should ask for something, help with this. So, and believe in yourself that you can do it. We are our best people in the lives of our babies. Sure.
So again, thank you so much for sharing that experience, and many experiences, and I think you're probably all feeling like me that there's just so much to take out of these interviews and learn from. I think one of the things that really was highlighted in that last interview was the benefits of telehealth that COVID have enabled, and I think Jody did a really amazing job of sharing how some of her experiences were really improved because of the access to telehealth. And so I would love to engage in some discussion in the chat box just about your own experiences with telehealth. We know that that is a strategy that was available before COVID happened, but it's certainly something that COVID has really placed a lot of emphasis on. And so thinking long-term, what are ways that we can engage with families to help support them through telehealth? What are the services and strategies that are missing? And so if you could take a moment to respond to this poll and then share any of your own personal experiences in the chat box, that would be extremely helpful. And hopefully we can engage in some of the discussion around that later on. So as you respond to that poll and share your experiences in the chat box, I'm excited to introduce our next panelist and the next interview that we'll be sharing with you. So Mr. Jamie Heingel is a young adult who has galactosemia, and we're so grateful that he's here to share his story and some of the transitions that he was making in his own life as a young adult moving out of his parents' home on his own during the pandemic. And so with that, thank you, Jamie, for sharing with us.
Jamie. I was born with galactosemia through newborn screening. Came home and my parents had to come back to the hospital within 48 hours. I wasn't doing too well as a baby, and so through genetic testing and newborn screening, they found out that galactosemia was the problem. So they put me on a different formula, and through the diet, I did really well. But now I'm on my own. I'm 24 years old, and I moved away from my parents about a year ago. So when COVID kind of hit, it was kind of difficult to figure out how to do my own thing, like figure out my diet on my own and cooking and everything. But now I've got all of that kind of solid and don't really have too many issues. But, recreationally, I run all the time and just kind of enjoy the time I have and do all my schoolwork as best as I can.
And where do you go to school?
Lynchburg, University of Lynchburg, and I'm in a master's program for athletic training.
Tell us a little bit about what you had to think about when COVID first started. Were there specific things that you were having to make decisions about, for your care or for what was going on in your life at that time?
Yeah, definitely when it hit before I moved into my own place, it was more so just, I lived with my grandmother, so it was more so just protecting my family. So we would go out to the store and obviously just like mask up and just be careful as best as possible. And when I moved into my own place, we did all the same things, but I didn't really have too many problems with finding the food that I needed or anything. it was through thinking about it more recently. I think it's been more knowing if I can trust going out with like restaurants. Like maybe the restaurants are limited with the products they have, so they have to use food that they're limited on. So if I say like, can you not put butter on it on this food, maybe they won't listen. Or if they just don't have certain foods that I can eat, then I can't eat them because of the restrictions that the restaurants have. So that has been a big thing that I've been thinking about recently, just the restrictions that restaurants could have due to my diet.
Yeah.
But everything else has been pretty easy. We go to Walmart for food, and that hasn't really been an issue. We get produce at Food Line because some of Walmart's stuff has been a little iffy sometimes, and they don't have like eggs sometimes, but that's about it.
Sort of thinking about, again, sort of throughout this last year, one of the things that we're learning a lot about are things that families and all of the different people that are involved in newborn screening and in the newborn screening community had to do. Were, there were certain things that had to stop along the way because of COVID. So was there anything in particular that you can think of that you had to stop doing or had to immediately change as a result of COVID?
I don't think so. I was pretty fortunate to not have a lot of, I guess, changes with COVID besides what everyone else had to go through. So I guess it was just figuring out how to make my own food being on my own. But I don't know if COVID really affected that since I was going to move anyway.
Mm-hmm.
And other than trying to figure out how I can substitute foods for other foods because of the diet. But I don't know if COVID really affected that as much.
So one thing you've mentioned to me in the past is sort of connecting and the importance of connecting with other families. And, we definitely agree and hear that a lot from the families that we do work with. So could you share with us a little bit about how you stayed connected to other families or other individuals that you know who also have galactosemia during the pandemic?
Yeah, I started through Facebook, one of our Facebook groups. Someone wasn't able to do their weekly support group that night, so I volunteered to help out, and it just kind of became a thing. We would switch off every other week or do it. I think it became twice a month. So it was interesting in the beginning for me because I'm not very good at talking to other people all the time. So meeting new people, especially with galactosemia, became, I think, really nice for me and for them to connect to other people in a similar situation. So talking about new foods that we've eaten or meals that we've made or just our life in general, like what did we do that week? What new things have we gone through? I think that really helped, just kind of reaching out to other people who are in a similar situation, like through diet-wise or like immune compromised or just really anything that's going on that other people don't really have a viewpoint on.
Absolutely. Were there any specific resources that were shared amongst within that Facebook group, or sort of anything that you came across that was particularly helpful? Were there things that families were really looking to help navigate through having galactosemia, managing galactosemia during a pandemic?
Yeah, I would say just talking about different brands that people could go to. So say like non-dairy cheese, if one normal non-dairy cheese was limited in a certain store, then we would talk about, oh, I've tried this other brand that you can get online and that's helped, or talking about different meals that you can make that can help those families navigate, because you wouldn't need those resources that they are used to.
We touched on this a little bit already in everything you've shared, but sort of reflecting back on the last year specifically of living through a pandemic and having galactosemia, what would you say are your biggest lessons learned?
Well, moving in on my own with COVID, definitely have to understand what I'm doing and what I need to get. There are a lot of times when I'm hungry and I may not have the food that I should have, like snacks, or just dinner wise, I may have forgotten an ingredient for dinner, or we don't have enough of that. So I would definitely say make a list prior and think about it a lot and understand what you need for like dinner planning or breakfast planning or anything.
You know, I know you've mentioned to me that you've created your own resources and tools to help you do that. So can you share a little bit about that with us?
Yeah, there's been some stuff online that I've gotten help with, but just having a list of different brands of food that I know are safe, or knowing, like, you may find some of this funny, but like chips or something that have ingredients that you can have or chips that you can't have, stuff like that. Like knowing even in the store where some of the yogurts are and the yogurts that are safe, and even asking some of the workers if they have that in the back is always a good resource. But just kind of like a little sheet. I have one up in the kitchen that has made from another company, but it has safe foods versus non-safe foods, and that's always good.
So along the lines of resources, and again, reflecting just on this last year, is there any resource or any support specifically that you can think of that you wished you would have had? You know, along the way, was there ever a point where you thought, man, it would have been really great to have this? If yes, what might that be?
I definitely had a lot of support from my family, and wish I did start doing that support group earlier. I think that would have been really helpful for not only myself, but hopefully other people. I think that would have been really good for myself, just to know what they're going through and how we can all help each other. But outside of that, my family really helped me. I can always call them and they just let me vent or give me a different perspective on what other people are going through, or how to go about making those meals or getting from point A to point B in life. So I would definitely say having family, connecting with family, or finding someone else that is going through a similar situation has helped a lot.
Anything else you want to add just about your experiences with COVID and what you've taken away from this last really crazy year?
Yeah, I would just say know what you need, and whenever you go somewhere, just advocate for yourself. I think that's a big part. Finding a support group as well really helps when you feel lonely. Or Jamie, I was born with galactosemia.
Sorry about that. Thank you, Jamie, as well. You know, I think each of you are probably hearing and seeing now how much we can learn from these shared experiences. And I just think it really highlights, you know, what families have had to think about. And it's different for every family, and we know that, but hearing from families directly is just so helpful. And Jamie, certainly one of the things that I think you highlighted well was the importance of community. And I think we've heard that through all of our interviews so far, and we'll certainly hear it in the last one that we're about to share, but just really the importance of identifying a community and connecting to that. So as a quick reminder, before I jump in to our final interview that we'll be sharing, we do really want to encourage everyone to stay on for the open forum that we'll be hosting after we have this last, or after we share this last interview. We really would love to engage with all of you and have an opportunity to hear directly from our panelists follow up with some more questions and just really build on what they've shared so far. So please don't leave us, stay with us for that community discussion, and definitely invite you to participate in that. So in our last interview, I'm pleased and excited to introduce Miss Megan Smith, who is the mom of 2 children, and her youngest child was diagnosed with cystic fibrosis just prior to COVID. And so in this last interview, you'll hear a bit more about her experiences of having a child with cystic fibrosis and the care that she had to advocate for during the pandemic.
My name is Megan Smith. I am married to my husband, Benjamin Smith, and we have 2 children, Elijah, who will be turning 5, and Abigail, who just turned 2. And Abigail was born with cystic fibrosis, and we did not know until she was born that she had this. We did not do any testing while I was pregnant because we had no known family history of it. And so we talked with my OBGYN, and we just decided that that wasn't something we needed. We had one son who, was okay. And so we just skipped over that. And she was born at 40 weeks and 3 days, and she was having breathing problems. And once they got that under control, they noticed that her stomach was distended and she had not had a bowel movement. And so at 1 day old, she had surgery on her intestines, and that's when they came back with the diagnosis, or the suspected diagnosis, of cystic fibrosis. And they told us that we were waiting on the newborn screening to come back to kind of confirm that. And they also sent off blood work for another test. So it was which either one came in first was kind of going to be the confirmation that they needed to 100% tell us that she had cystic fibrosis. But she spent 28 days in the NICU, and then she was able to come home to us. We have had 2 hospital stays since then. We actually just got out of the hospital last week for some bowel issues again. But looking at her, unless you saw the scar on her stomach, you would never know that anything was wrong with her. She is spunky, she is feisty. She keeps everybody in this house in check and lets us know exactly what she wants. So that's just kind of our
Back a little over a year ago to when COVID was first starting. Abigail was about a year old at that time. Sort of tell us about what you were doing and what you were thinking about in terms of life at that point in time.
Yeah, so it was really interesting getting kind of thrown into this situation because once Abigail got out of the NICU, we had, I'd say, like 2 months of what I call our freedom. And then we went straight into flu and RSV season. And so we actually started quarantining with Abigail like October, right at the beginning of September in 2019. So right as we saw the light at the end of the tunnel in the beginning of 2020 is when COVID hit. So we never really stopped quarantining since 2019. So it's, we kind of got thrown in the deep end with it, but it gave us a very fast track as to what life looks like with a child with cystic fibrosis, because as she gets older, she will have to wear a mask during flu and cold season and RSV season, out in public. And we will too with her, and washing hands and, germ control and all that is just a normal thing for a person who has cystic fibrosis. We all hear the 6 feet rule right now. Well, that's a normal thing with cystic fibrosis. So it kind of really immersed us into this before we had a chance to even get out there and experience it. So that was, I hate to say like nice, but a lot of CF parents say that we're already experts at this, like quarantining and germ control and wearing masks. It's just part of our everyday life. So,
Parallel.
right. It's like they go hand in hand. And while we're learning about it, the rest of the world is learning about it alongside us. And while for the rest of the world, it is coming to an end because there is, the vaccine coming out and all that, this will continue for our family. So, so now the rest of the world will have a little taste of, what we've got to do to take care of our girls. But
there are sort of specific things, equipment wise, or things that you were anticipating or that you needed at the beginning of COVID?
So when you saw the grocery stores like bare, like that was really scary. And so we had to plan ahead on like trying to stock up on things for her. The medicines, I mean, you were hearing she does nebulizer treatments. And so some of those medicines that they were using in the hospital are her daily medicines. And so you were hearing through the grapevine, like there might be a shortage on like hypertonic saline and some of the other stuff that she takes. So it was like, okay, do we start hoarding this stuff? It was the mask. I remember the mask was the big thing because we were just getting into it. So we were just starting to like buy masks in 2019, just for us being out in public during flu and RSV season. And then it was like masks were nowhere to be found. And it was like, okay, well, what do we do? Like after my husband had to go back to work, he had to have masks. And that was a big thing for us. It was interesting. I mean, I don't even know how else to describe it than like crazy.
Sort of thinking about your experience over the last year, or even right at the beginning, were there specific things that come to mind that you had to stop doing as a result of COVID?
Yes. So, I mean, one of the big things was, we decided to pull Elijah from Mother's Day out. And that was really hard because he's such a social child. He loved it. He loves to learn, like he asked to do school. So that was a big thing. And I was so worried about him not getting that social interaction with other children. So that was a really tough decision. Another thing that we couldn't do was all of our family is back in Arkansas. So we couldn't go home. So Abigail has like her great grandmother that she's never met. I couldn't just run to the grocery store with the kids. It had to be a planned out thing where either my husband was at home with the kids or he would stop on his way home and get them, because we couldn't take Abigail anywhere in public, anywhere that might be crowded and we might not be able to distance ourselves from others. She wasn't allowed to go. So we couldn't go to church. We couldn't go to play groups, with other children. It's been, I don't want to say it's been like isolating, but it has been isolating. Yeah. Her doctor's visits have changed. With her CF care team, we used to see her pulmonologist and a GI doctor and a nutritionist and a social worker to help with like the financial side of things. And it got trimmed down to just, the CF doctor himself. And so even things like going to the doctor have changed.
Did you all utilize telehealth services for any of Abby's care during the pandemic? Is that how you...
So for her CF care team, we didn't, because they really need to listen to her lungs and stomach and all that. But for her regular pediatric appointments, yes, we have. It's nice and hard because sometimes it's hard to exactly explain. A 2-year-old or 1-year-old at that time can't sit down and be like, it's my stomach or, this. And you can't really see over a video call. But it is nice not to have to pack 2 kids up and go in and, all that. So
I'd love to hear a little bit more about any other connections that you may have had to families within the cystic fibrosis community or the newborn screening community. were you connected to other families, or have you been connected to other families during this last year?
Luckily, we live in such an age where the technology can keep you connected and you don't have to be face to face. So, I mean, Facebook groups and FaceTime calls and all that have really been a blessing. We have another family with a little boy who has CF, and we'll talk all the time and discuss what's going on. And we have the same doctor. So it's like, okay, you know, you just went, what did he tell you about what's going on? And like, we'll keep in contact. And I work for the Oklahoma Family Network, and we have support for parents who have children with a genetic diagnosis or mental health issues, or really just anything across the board, NICU stays, anything like that. And so we have amazing support groups and conferences. I think it's pulled creativity out of a lot of people to figure out, how can I connect groups and make it fun and engaging? And that's been really interesting to see, because where you would used to have a meeting for new moms in person, it's like, okay, how can we do like a sip and meet over Zoom or, you know, on Facebook chat? And so I think getting engaged with that, it has been hard, but really building those supports through, you know, Facebook or Zoom. And the Oklahoma Family Network has done an amazing job with that and keeping that going. So it's been really interesting.
So, yeah, I think just having, you know, kind of having lived through the last year and reflecting on a year of COVID and navigating all the things that we've had to navigate, I'd love to hear what your lessons learned are, and what would you think about going forward in terms of Abigail's care?
My biggest lesson is, because I am a planner and I like to know what's going on. And sometimes you just can't. You just got to go with the flow and readjust, and that's okay. Mm-hmm. And definitely finding your community, finding your group where you feel like you have a safe space to talk, because during those days where you have that plan and it doesn't go like you want it to, finding those people that you can say, today was so bad, but you know what? We're going to wake up tomorrow and do better. And I just need to vent for a second and, you know, get over it. So finding those ways to do that, but also finding ways to be there for other families and building that community, I think was really, really important. And I think that's what got me personally through it, is the support that we had in our friends and families, and even moms that I did not know, you know, just coming together and talking one night was really, really helpful. And so I think that's a great thing also moving forward, is keeping that momentum going, building that community that works for you and your family, I think is very important. And I really hope that that continues, you know, after some sense of normalcy comes back from COVID. My name is Megan Smith.
So I want to thank Ms. Smith as well. Again, just incredible tidbits of information and knowledge that we can gain from the experiences that she shared. And as we start to transition at this time into our open discussion, I'll share in just a moment sort of a summary of some of the key takeaways of these interviews, but we also want to continue. We encourage each of you to take this time to engage with our panelists and to share your experiences. If you feel comfortable, turn your camera on. We really want to sort of use this last 25 minutes to really have an open forum and an open discussion of what is working within the newborn screening during COVID, and what are things that we need to be thinking about to continue supporting and strategizing for smooth family experiences from all of the different perspectives that we've heard. And in this last poll, we would love for you to just take a moment to share a little bit more about your experiences accessing resources. I think that was an important point that Ms. Smith highlighted, and just sort of the challenges that presented and the things that you had to think about when you did see bare grocery store shelves and had to start planning, not knowing exactly how long you would be planning for. So thank you for all of you who have responded to these polls and for engaging through these polls. And at this time, just wanted to provide a quick summary as we, transition into this open discussion time. And I think hopefully what came through from these interviews is really in terms of things that many families were thinking about at the beginning of COVID was really hybrid models of care, and sort of how was the care that they needed to receive going to continue. Certainly an increased awareness of resources, whether that was accessibility to the food that Jamie needed, or accessibility to some of the resources and equipment, or accessibility to services. I think just access to care was a really important part of what families were thinking about. And certainly what we also heard from providers as well as state laboratories. In terms of things that we heard families really weren't able to do when COVID first started and throughout the COVID process, was the challenges of childcare and the challenges of visiting family and the support systems that were previously in place and the limited social interactions. And so really thinking about how can we as a newborn screening community come together and provide those supports for families. And then really thinking about those strategies moving forward. What does that look like? What do we need to create? What are the tools and resources that need to be generated so that creating communities of support is a process where we minimize those barriers? And how do we make it easier to start sharing resources, with families so that they do feel like they have access to the support that they need? So I also want to thank Megan, Jamie, Isis, and Jody for not only sharing your time through these recordings, but for being here today. We recognize that it is not easy to carve out the time that you have with all that you have going on. And so, from all of us to you, thank you for sharing these experiences. With that, I want to start by opening it up to anyone that's listening. If you have questions, please feel free to unmute yourself and ask. We would love for you to do that, or any comments on what you've heard today or strategies that you've utilized yourself, in your work with newborn screening. So I'm happy to start and ask a question, and feel free, I think Megan, you touched on this in your interview, and Jamie as well, but just to build on the strategies around building those communities of support. I was hoping you could speak a little bit more just about how you did that. Kind of what were the practical and logistical things that you did to generate those communities of support, to find out about them, and really to think about growing those communities of support. Jamie, would you like to speak a little bit more about the Facebook group that you jumped into?
Yeah. So building the community, I just kind of got my foot in the door. I searched a lot throughout, like Facebook or other social media sites. Thought that was very helpful. There's a lot of people who just kind of use social media, just easily, and to find other people. So I found a lot of other people similar to me with galactosemia. And with COVID, everyone just wanted to talk to more people. We found out that everyone was limited socially. We weren't able to connect with other people. So that was a great way to connect through Zoom meetings or Google Meet, and just by posting something easily on Facebook. And then from there, connecting from one person to the next and getting everyone else's contact information, and just going from there. It was a great resource for me to meet new people and to just stay informed with what everyone else is doing.
Yeah, thanks for that. I think we definitely hear, a lot about connecting through social media channels, and that works great. But we also recognize that not all families utilize social media, and so sort of thinking through how can we support families who maybe aren't as plugged in through that channel. But I think it's a huge help to understand that they're out there, and how to connect with them. Megan, did you want to comment as well? And I know you did. Sip in chats and some other.
Yeah, so I think one of, the things that I did was just, with the moms that were, experiencing NICU stays, is just, trying to start building a community through Facebook, and then just slowly engaging by just asking simple questions, how is your day? Just things like that, and simple engagement to build a sense of community and trust, but then again, to where they could also just kind of sit back and maybe watch until they were comfortable to jump in and ask a question or start a conversation. I think that's the really great thing about Facebook is you can kind of sit on the sidelines until you're ready to really immerse yourself in it and get involved. And so that's been good. And then once we kind of built it up for us, then we would say, hey, do y'all want to get together one night and do a Zoom and just talk? Just, it doesn't have to be about anything in particular. It can just be just talking or just venting out your day, nothing in particular. And so that's good. And then I also think that a great resource is, we had an established like cystic fibrosis foundation. And so they had an established Facebook page and group set up. So I was able to connect with parents and learn from them already, so that was something that I was able to join into as well. So if you don't find something out there that is what you're looking for, I would suggest, slowly trying to maybe start building it yourself and, reaching out to others and building your own community if that's something that you don't really see out there. So, yeah.
Yeah, thank you for that. I know we have a lot of people from state laboratory programs and parent organizations and advocacy groups listening in. And so I think this is so important to just highlight that each of you who are in different sort of points of your newborn screening journey have mentioned the importance of community. And so even from a very early point in that experience, connecting to others has been hugely valuable. And that's not necessarily unique to COVID, but it was certainly more emphasized during COVID. So I think, for all of us, again, to just think about how to one, encourage families to seek those opportunities out, but two, to grow and build the opportunities that exist. And so just as a reminder, we've shared a few of the resources that were mentioned in the interview in the chat box and several of the support groups that our panelists have shared. So please be sure to take a look at that. Is there somebody that wanted to join in and comment or ask a question?
Hi.
Go ahead.
This is Lisa Scheuer from Los Angeles. I work for the Department of Mental Health and started with birth to 5 mental health, actually. So just interested in the whole mental wellness perspective of it all. I was curious about with ISIS how you connected with the Sickle Cell Foundation. who helped you connect?
When I got to the Children's Hospital, there was a lady from the Sickle Cell Foundation that was there that was going around enrolling people. So she just came to the room that I was in and had me fill out the application, the paperwork to be a part of the foundation. And then within like a couple weeks, somebody reached out to me and was just telling me about, what the Sickle Cell Foundation is, and just explaining to me what they do and how can they, help with me and my kids. That's pretty much it of how I came across the Sickle Cell Foundation.
That's great that they went into the hospitals looking for
Yeah,
families.
definitely. I never knew about the
Sorry.
Sickle Cell Foundation. It's okay.
Any other questions or comments for our panelists from those of you that are joining us? Check the chat box as well. Jody, I was wondering too, if you could maybe speak just a little bit more to communication strategies that you've found successful. I know, in particular, you talked about sort of some of the challenges in your area of accessing care. And so I'm just curious if you could elaborate a little bit on, who has been going back to sort of during COVID, but also at the time that your son was diagnosed, who was communicating to you, what prompted you to follow up, sort of what were some of the successful communication strategies around that? And is there anything that we can sort of take from that to think about?
It was pretty much just me doing it all. I prior to delivering, my son was working in the school system in the early childhood area. And so I knew the lack of services from my job. And so I pretty much prompted everything. My husband has a hearing loss as well. And so we tapped into the same team that serves him. And I would say that the audiologist is the one who really sparked all of the services related to hearing. She's the one who prompted the early childhood screening. She's the one who prompted a deaf mentor. She's the one. So I guess she's the one who sparked it. And then I was the one who followed through. And when we were going in for our follow-up appointments, I would just report to her whether we were receiving services or not. And there was one point where we still weren't receiving services she had recommended. And she's like, before the end of the session with her, she had already filed another reference or not reference, but referral for him to receive speech therapies because there is none up here. So yeah, I guess it would be her that really got the ball rolling.
That's helpful. Thanks for sharing. Any of the panelists want to kind of comment on that, sort of thinking specifically about who communicated to you about your diagnosis or your child's diagnosis, and sort of who was involved in the connections that you were making to specialty services?
I think for us, it was, she was in the NICU for 28 days. And so once we got that confirmation, the specialist, the CF specialist saw us in the NICU, and then we just, kind of followed up from there. The millions of appointments that you have after your child gets out of the NICU, it was just kind of following up with that for us. but they originally saw her while she was still in the NICU. So we had that base, that foundation, I guess, already in place before we got out.
Yeah, thanks. So I'll pose this more as a kind of comment for the entire group and welcome people to sort of share feedback, our panelists and people that are still joining us. For me, sort of having gone through now this entire series and really thinking about what are we learning, what are the lessons learned, there's some themes that I have heard emerge and that we're sort of evaluating and looking more into. One I mentioned earlier was sort of adaptability and flexibility. One is really thinking about communications and how do we ensure communications between all of the different stakeholders within newborn screening are happening and that those dots are connected. The one connection throughout all of the communications are the families that are being supported. And so how do we as a newborn screening community ensure that all of those touch points along the way are smooth? And then the sort of the other theme or thing that I am hearing emerge from these discussions is really that community and family support. So I would love to hear from people who have been involved in the communications to families with regard to newborn screening results during the pandemic. How did you do that? What were the barriers that you all experienced, and what are potential, opportunities that you identified to help improve that process? Do any of our panelists have any additional comments on that? Just kind of thinking specifically about, who communicated to you about your results. Anything to add there?
I know that we had a tough time with our newborn screening because it was, the NICU told us that that's what we were waiting on for confirmation. And then we got a letter in the mail that said that she needed further testing because it is a screening and not a diagnostic, and that we needed to follow up with all these people. And so it was, for us, and we are in Oklahoma, it was a little confusing because we were getting told one thing from the hospital that she was at, and then one thing sorry, that's her. We're on our way home. One thing by this letter that we were getting in the mail, and it just felt like the letter was adding on more people that we were supposed to contact through the State Department while she's still in the NICU. So for us, it was a little confusing and hard because it was like, she might have it, but the NICU is saying that this is what we're waiting on to confirm that she does have it. And so it was a little tough for us to figure it out, I guess. So
Yeah.
it wasn't a great experience, I guess you could say.
Isis, I'm wondering if you can comment as well, specifically because you were getting results really when it was very challenging to do some of the follow-up testing that was required. So could you speak a little bit to your experience of, when you first were notified or first contacted about your daughter's results, and then how you had to follow up and what that was like for you?
When they took her results sorry, my mind is everywhere. When they took her results, when they're in the hospital, they do the blood work and stuff like that. So once I came and brought her back to the doctors, I think it was like a week later, if I'm not mistaken, or a couple days later, they told me, the doctor told me actually that she had sickle cell disease and to contact Children's Hospital to schedule her an appointment so they can start her up on the medications. And I think that was about it. That's how they brought it to my attention. But I know I had to go to the doctors like a couple days later just so she could be seen. And then they told me from the newborn screening that she did have sickle cell disease.
Okay. And you didn't have any problems or challenges getting to her confirmatory or follow-up testing?
I don't think I had any challenges. Not that I can remember. No, I didn't. More of my challenges was trying to process it myself.
Absolutely. I know we are coming up on time, so before we come to a close, again, I can't thank you all enough for sharing your experiences and for making time to do that. I really think there's a lot that we've gained from what you've shared, and I know that it will certainly help us think about how can we continue and improve the support that we provide to families. So thank you for that. Thank you to all of you who have joined us today as well. We tried something a little bit different with this time. So we want to ask one last poll before you drop off, and would really love your input and feedback on your thoughts about the timing of this session. And, we recognize that it was 90 minutes of your time. And so thank you for sharing that with us and for engaging with us and for participating. As a reminder, we will be, or this session was recorded, and we will make this session available on our website, and we'll communicate that to you when it is available. And all 3 of the sessions that were a part of this webinar will be available to you all. So, thank you for the comments. Thank you to our panelists for juggling it all and making it work. And thank you everybody for joining us today. I'm happy to, take any questions or contact. Please feel free to email me. I will share my contact information here. And I hope everyone has a great evening, and thank you so much.